backgrounds to kind of talk about how to navigate schools and when things arise. So thank you all for coming. We appreciate you being here. Okay. There's a little key.
Oh, yes, kind of look like a walkie-talkie.
It does.
All right.
I think
Very
it's
fancy.
this for and that back.
Got it.
Okay.
Thank you.
Cool.
Perfect. Okay, right on this side.
That sounds good.
You can take turns.
Perfect.
Go for it.
Am I doing it right?
Oh, you did. Yeah.
Oh, great. We're so happy to be here with you this afternoon. My name is Ryan Hanna, and I'm a school liaison specialist at Cincinnati Children's. And I specifically work with our brain injury population at Children's in our Brain Health and Wellness Center. And I work with mild brain injuries, those with concussions or what we call like our mild complicated brain injuries.
If I stand back here, can you guys hear me? No. Sorry. I didn't know how far it would pick up if I was over there. And I'm Carissa Lloyd. I'm a school liaison specialist at Children's as well. And the population that I work with is the oncology population, specifically solid tumor and neuro-oncology.
You got a really.
Is it this one or this?
There we go.
Oh,
Oh.
here we go.
All right, so we have just wanted to go over our agenda for today. So first thing we're going to talk about are the different types of school support plans. And we're going to focus on like the more formal ones that schools can create to help support kids with chronic medical conditions. The second thing we're going to talk about is just a brief overview of the support plan creation process and how that would work if you're pursuing that with the school. The next thing we're going to talk about are special education and 504 truths and myths, and we're going to quiz you a little bit on what you guys know. So hopefully we'll get some participation that was started with Monica. We're going to share some family resources with you. And then finally, we'll leave some time for some questions and discussion. Like a little dance.
I apologize. I'm gonna have my notes in front of me too. That way I'm not turning all the way around. It's a Friday afternoon in the summer for us teachers here. So, we're still on the teacher schedule, the teacher life. So we're going to talk about 3 different types of school support plans that you may experience or have someone a child that you know or a friend that's in school and may need some additional supports. So we have individualized education programs or IEPs. We have 504 plans and then individualized health plans and IHPs. I typically say IEP and then I'll say individualized health plan because IEP and IHP get confusing and then I'm saying the wrong ones. So the purpose of an IEP is to set learning goals to close learning gaps for a child. The eligibility for this one, we kind of go in order of most intensive to least intensive. So the eligibility, a child has to have a disability of one of the 13 categories outlined by IDEA. And we can find all that online too. So if there's ever any questions about what disability category is in there, those are all online. They have to have significant impact in their educational performance and they require some type of specialized service. So those special services can include time with a special ed teacher or Ohio uses a different term. Why?
Intervention specialist.
Intervention specialist. Sorry, I was a Kentucky special ed teacher, so we say special ed. Modifications to the curriculum, accommodations, and even potentially like OT, PT, speech, different services like that through an IEP. A 504 plan, the purpose of that is to remove any obstacles for the child's learning. So the eligibility, as we move down, it still requires a student to have some type of physical or mental impairment of some sort that impacts their daily functioning. And their services through that include mainly accommodations. I have seen modifications rarely, but they do sometimes can be included on that as well. The purpose of all three of these plans is to be individualized and meet the needs for that specific child. So if you ever look at somebody's IEP, it should not be the exact same as another child's because that's not individualized. And then our last one there are individualized health plans. Those are just formal agreements between a school, family, districts of some sort. They all look a little different, but this may be for a child that has a medical need, but it doesn't impact their learning. So they may need some specialized medical equipment at school, or medication for the nurse typically is the one that monitors these plans. The format is very different. It can be added on to an IEP, a 504. It can just be kind of like a verbal agreement between people. This one is the least rigid of all the plans. And our main thing that we want to make sure that we say probably 1,000 times throughout this presentation is if you have questions for your child specifically, connect with school. Everybody, their plan's going to look different. A child may not need a plan. It may just be that communication. So things that we say today probably are going to be like, well, it may depend on, and then the needs and communication with the child's school. I think I am pressing the wrong one. Sorry.
So it's this middle one.
Yeah.
Oh, okay. I see. I wasn't pressing that one either. Okay, now we know. So next we're gonna talk about the support plan creation process. Carissa just talked about the different types that can be created for a student in school with a chronic medical condition. The creation process really follows kind of a typical trajectory, regardless of the type of plan. However, and you may know this, for an IEP or a 504 plan, there are specific timelines and components that are outlined under like federal special education law or under other guidelines that may impact that. But in general, these are kind of the steps that you would expect if you went to the school to discuss a support plan for your child. The first step really is what we call like the identify stage. And that's where you as the parent or caregiver goes to the school and says, I have a concern about my child. They either have a medical diagnosis or you have a concern about their learning, and you're letting the school know about that. So the identification process is usually going to come from the parent or caregiver. And in addition to just letting them know that that exists, you are also letting them know that that is either already affecting them or may affect their learning in school, because that's always the important thing that we're considering when we're talking about a support plan. There has to be some adverse impact to their learning in the school setting. In some cases, the school may be the one that notices it first. For example, the teacher may notice there's learning problems and may come to the family to bring that up. But in general, I think when we're talking about a medical condition, it's usually going to be the family or caregiver that brings that to the school first. And we'll talk a little bit more about the identification process in just a moment. The second step is really the evaluation to determine eligibility for a support plan. And also as part of that, what support plan may be most helpful for that student. So that's going to most likely involve a meeting or multiple meetings, a review of some type of data, looking at information that the family or caregiver provides. So that may be medical information, reports, therapy, evaluations, things like that that the family gives, as well as data from the school. And the type of data that the school may be sharing would be attendance data, grades, testing results, other information the school collects, as well as some type of evaluation. And this would be most relevant for an IEP that the school actually conducts during an evaluation process for an IEP. So really, it's a combination of all that information that the school and family kind of combines together to determine that eligibility for a plan. The third step is really the plan creation. So after that evaluation, the school team and the family team come together. Typically, this is going to take place at a meeting, and everyone discusses what the plan is, and then they discuss what that plan may entail, whether it be accommodations or specially designed instruction, and what's best to help support that student. So then once that plan is created, we move on to the next step, which is really where the services are provided. That's where that plan is put into action. The services begin to be provided, whether it be through an intervention specialist or the actual accommodations that are given. So at this stage, something different is going to happen for that child at school. So they're going to receive an extra service or extra help, and more support. So is going to be provided so that that student can hopefully improve whatever that adverse effect was that we talked about originally. And then finally, the last step, which we really want to highlight this step because we feel this is very important, and this is often what we help families with, is really the monitor and reevaluation part of the process. We really want to work to see that that plan is working as intended and that it's helping support the student in the way that was discussed in the earlier parts of this process. You guys may all know this, but just in case if you don't, an IEP, if a student has one of those, that's going to be evaluated on a yearly basis, just under federal special education law. So you would expect to have a meeting yearly to review that IEP. And then in addition, every 3 years, that IEP is going to be completely reevaluated and the student's special education eligibility is going to be looked at again to see if they still need that plan or not. So those are going to automatically be like standard reevaluation times that occur. And then for a 504, it's a little bit more vague for that when those are reevaluated. So some schools are going to automatically on an annual basis review a 504 as well. But Chris and I work with schools where that isn't automatically the case. So what we really do recommend for families of students who have 504s is to initiate that annual review yourselves. And oftentimes the beginning of the school year is a great time to do that, where you just say, hey, we're starting a new year. Let's look at this plan, decide if any of the accommodations need to be amended, changed. Things may need to be added if something new has come up. And there may be accommodations that need to come off if that student's either not using them or they're not relevant anymore for that student. Another thing we wanted to mention is that for that reevaluation piece is transition times are a great time to look at these types of plans as well. So when a student's moving from elementary school to middle school or to high school, even from grade level to grade level, looking at these types of plans is very important because those settings change. For an individualized healthcare plan, I think it even gets a little bit more vague about when to reevaluate that. Honestly, I think when something changes, that's when you need to reevaluate it. So if something with your child's medical condition changes, really it's a phone call or a meeting request right away to get that fixed or amended so that that plan meets your child's needs as soon as possible, because you don't want to let time lapse and have something missed with that. Just catching my spot here. Even though, yeah, and okay, I know what I want to say here. This is always our advice to families. So even though there are specific timelines and the advice I just gave you, you guys as caregivers and families, you can always request a meeting to discuss any concerns or questions that you have with schools. Now, schools aren't always making big billboards to tell families that. They're going to always follow through with the law. And if they're not, certainly we will give you resources to call or follow up about that, because you should have a yearly meeting on your IEP. But we do want families to be empowered to call meetings, IEP meetings, 504 meetings, even informal meetings if you have concerns or questions about any of these types of plans. I think when we work with families, they're surprised to sometimes learn that you can have multiple IEP meetings in a year. It's not just always one. So if any concern arises even outside of that annual review for your IEP, you can have another meeting because concerns pop up, multiple times. So just keep in mind that you are always empowered to have meetings with the school, even if they're informal ones, because we want your students to be supported, and sometimes that means you need to meet with the school more often. And I think that's what I have to say about that. Okay. Now I know the right button. Oh, there is something else. Yes. So I'm going to talk a little bit more about the identification process. So in order to start the identification process, we just wanted to talk a little bit more about 504s and IEPs, because requesting an evaluation is a little bit more specific. And when you reach out to the school for an evaluation, we always want to talk about like how to do that. So we work with a lot of families sometimes who tell us that they mention it verbally or that they just talk to the school about, well, I think my child needs more support. We always want to talk about doing it more formally in writing to request a special education evaluation or a 504 evaluation, because without that written or really more kind of formal request, the school is not going to take action upon that. Um, so I bolded written here, and we usually do say do it via email as well so that there's a paper trail. And then you can keep track of when that was submitted. For an IEP request, once that written request is received by the school, they're under a timeline then to follow up with that request. And then that timeline starts for the evaluation process under the federal law IDEA. Okay. Let me just make sure I know where I'm at here. Um, and then, as I said earlier, parents or caregivers are going to be most likely the ones that are submitting that request for the evaluation. But in the case of a learning concern, the school personnel may be the ones that are bringing that up. But really, the two groups that we're considering here who are requesting the evaluation are going to be the parents or caregivers or the school staff. And at the end of today's presentation, we'll have some resources for you about what a request for an evaluation looks like. I think sometimes families are not always sure exactly how to do that or what it looks like, but just briefly, it does not need to be anything complicated or long. It can be a very short written email stating a medical diagnosis, stating that you have a concern about your child's learning, maybe a little bit of additional information, but then just stating in black and white print that you request an evaluation to be done. And then following that, we always encourage families to share medical information, data, and reports with the school once that evaluation starts. So it really can be very simple to start that process. But without it being in written form, the school can kind of dismiss it. So we really want it to be kind of in that formal way for you to get that result or get them to respond in the right way.
So Monica got you guys started with a little bit of audience participation, and we're going to continue that. We won't put anybody on the spot, but we're going to do some truth or myths. And we just want to know what you guys know. As former teachers, this is almost like second nature to us, but we know as families navigate this, it's not. So we want to like break down these myths or truths and see, what do we know? What more can we learn? So our first one, physicians can prescribe an IEP or a 504 plan. Any thoughts? Is that a truth or is it a myth? It's a myth. Yes. All right. Let's see if I can get this. It is a myth. So I think, especially from my time being a school counselor, I would actually have physicians on a pad, right? Child needs IEP. And the family's like, here you go. This is it. All right, let's get it going. I'm like, well, that's not the process here. So the physician can be a huge part of this, but they can't tell the school that they have this. They may recommend an evaluation. They can provide documentation that may be helpful to have with the evaluation process, but really it's between the school team and family and the eligibility criteria. That's the biggest piece there. They have to meet that criteria that has been outlined by the federal government in order to qualify for those services. So it is a myth, but it is something that even though we're in 2025, we still see a lot. But it's kind of in our roles, we are part of that medical team. I say medical because we're teachers by trade. So we know the background of schools. We know how the school process and everything works. And it's really educating our physicians too. That's like, hey, that's actually not how this process works. Here's what we can do to help make this a collaborative process. So that is a myth. You guys are 1 for 1. It's a lot of pressure.
All right. So we're going to talk a little bit about the differences between accommodations and modifications. And Chris earlier did a good job of explaining the difference between an IEP and a 504. And that really is kind of what this relates to. So when we're talking about accommodations and modifications, interestingly enough, and you all may know this if you have children with these plans, a 504 plan is only going to have accommodations, whereas an IEP can have both of these things. So if your child has an IEP, they most likely are going to have some set of modifications to their curriculum as well as accommodations to help them within the school setting. But I'm going to talk just briefly about the difference here. So for accommodations, the main difference or the main purpose of accommodations is simply to allow the student to access their learning within the classroom. So it removes barriers to their learning. It does not change anything that the student is learning. So I want you to just think of a student in a classroom. It's making the environment more accessible to them. They're on grade level. They're learning the same curriculum as their peers without any support plan. But just for an example, let's say that they have some test anxiety, for example. And if they were to take the test in the typical classroom with the same amount of time, their performance may be affected because of that anxiety. So an accommodation that would be provided to them is that they receive extra time and they may be tested in a quiet area so that they can actually show their learning and they can perform to their typical level and do well on that curriculum assessment. That would be the accommodation that would be provided on their 504 plan to help them. That's the accommodation, that extended time. Now, modification is very different because when you have a modification, you're actually changing the curriculum for a student. You're changing what they're learning because they are unable to perform on grade level. And that's really where the IEP comes in, as I said. That student has an IEP with specific learning goals for their level in order to help them be successful. And that curriculum is changed to help meet their needs. So back to that classroom, the student may still be participating with the same kind of content in that classroom and maybe learning about the same topic, but the materials are at their level and tailored to meet their learning needs. So the way I think of it is, let's say the whole classroom is reading about the Titanic. The book that child on an IEP with a modification may be reading is specifically on their grade level, while the other students may be reading at whatever that typical grade level is. And then when they take their test about that book, they still may receive an accommodation where they take a test in a quiet area with extended time, but they're also taking a test on a book that's at their level. So that really is the difference between the accommodations and modifications. Yeah. I think what we do want to say, and I didn't know if you wanted to add anything about modifications you've seen on a 504. I don't think that, like, do you have any examples?
No, off the top of my head.
Okay.
I don't really think about it,
Yeah.
But
I think what I would say is that what we notice working with different schools is that some schools are more comfortable putting modifications on 504 plans, whereas some schools hold very hard and fast to that rule of like there's absolutely no modifications on a 504 plan. So I think Chris and I, and maybe you all as well, depending what school district you go to or what your children go to. It really just depends on the school, what they're comfortable with. But in general, you can usually expect accommodations only on a 504 and modifications on an IEP. Okay.
So I know Ryan and I mentioned that we're not as familiar with the neutropenia population just because we work with brain health and wellness and oncology, which I do have kiddos that experience neutropenia with the chemotherapy that they receive. But we thought about like writing out some possible accommodations. You guys are the experts here, so we're really gonna rely on your expertise to say like, yeah, you kind of are on the right track. Or for my kiddo, we experienced this and this was super helpful at school. So I just kind of put some areas that you may want to talk to the school about. So like hygiene or like cleaning of classroom supplies. I know this is a big one with my oncology population is if they're actively going through treatment, we want to stay away from as many germs as possible. So do we have separate set of materials that only our kiddos use? Or do we, every time we get up and we do a group activity, the teacher wipes down the desk with some type of sanitation wipes and things like that. So like that's a big area I think to consider talking about, especially in our younger kiddos, because everybody knows everything goes from hands to the mouth. It just never fails. Other things like treatment related side effects. So joint pain, do they need access to an elevator or if it's a multiple floor building? Alopecia, is there some type of head covering, that we can wear at school so it's not, I feel like more so middle school with my kiddos or like, I don't want to look different than others. Even though wearing a hat and others aren't doing it, it takes, them looking away from me. They're more looking at my hat or things like that. Attendance plans. I think this is probably one of the areas that is the most gray area, and schools don't typically like to talk about it because their regulations come from the state. And I think kind of like what Ryan was talking about, the varying things with 504 plans. I've seen schools put attendance plans in there, or they say like, we excuse all absences and it's no problem. And then I've been in meetings where they're like, no way, we can't put anything about attendance in a 504 plan. But I think coming together,
I'd say too, some states have like their own separate form for
Right.
chronic medical absences, depending which state you're in. Ohio doesn't have that.
but Kentucky does.
Kentucky does. So it really, there's so much variability depending on which state and even what district you're working with. So
Right.
totally.
Yeah. And I think just knowing, especially like your child best, and you may notice like, hey, when we get a fever, we're out for at least X amount of days. And bringing that to the school so you can come up with a plan that's like, all right, well, and when this happens, we switch to Google Classroom or, whatever there now since COVID, I feel like there's so many alternative means of instruction that we haven't experienced prior to that. So you have a plan for that. Or like when we're out, we have extra time. We have double time to get the paperwork or the assignments back to the school. So just coming up with a plan and figuring out what's going to work for your child and that also meets the school's needs, because a lot of times schools come down pretty harsh on families and students, but it's because the state is coming down on them. So they have certain regulations that they have to be in compliance with, and then that kind of trickles down from there. Is there medications that are needed at school? I think the school nurse is a wonderful person to get connected with, especially in my role as well. They seem to know everything about the inner workings of the building, they know the kiddos, especially if they're there for like elementary school all the way, from kindergarten into fifth grade, things like that. Medication is huge, having those forms filled out and completed early in the school year. And then parental notification, like, is there certain times that we check for fevers? Is there a routine with that? If we can't reach one guardian, what's the plan after that? How soon do we wait to contact the next person? So I think just coming up with a plan and then knowing, like Ryan said before, you can reach out at any time and be like, okay, this is not working. And the elementary school did this one way, but now they have 7 different teachers. We need to figure out a way that this is going to work in middle school. So I think just coming together at the beginning of the year and making sure that everyone's kind of caught up to speed, and then saying, okay, like, let's meet maybe back after the first quarter, reevaluate, are things going good? Great, let's keep going. If it's not, what can we change to make it better? And then emergency contacts. I think it's always, schools try to do this at the beginning of the year anyway, but making sure if you change your phone number or things like that, tell school. That's the first number they're going to call, is whatever they have in the system. So sometimes numbers change, emails change. Make sure those are updated with schools as soon as possible. Is there anything that I was missing that yeah. Right. Yeah. Mhm. Yeah, that's and a good point of being just proactive in that communication because a lot of times we'll get referrals and it's like, well, they're going to truancy court because they've been absent for so many days, but school didn't know they had a medical condition that causes them to be out of school, for periods of the time. Schools are so much more willing to work with people when they know things ahead of time. When it gets to truancy court, things are already pretty bad that, the relationship there with school has been broken and that tends to not be repaired easily. So I read how you mentioned that. Like, yeah, it does trickle to other parents and things like that. But I think that communication ahead of time is super helpful. Thank you.
All right, we have a poll question for you. So after talking about accommodations and modifications, so our scenario here is Dolly, a student with chronic neutropenia, struggles with joint pain. Her family and her school team just recently evaluated her for a 504 plan, and they're now meeting to discuss the accommodations they think would best support her needs at school. Which of the following do you all think would be an appropriate example of an accommodation that could be included on her 504 plan? So I'll read the choices for you and then we'll see what you all think. So A would be access to an elevator. B would be modified curriculum materials. C would be behavior intervention plan. And D would be assigned one-on-one aid in a multi-disability classroom. You want to do show of hands or just call on somebody? What do you got? Oh, they got it. I did hear some right answers. All right. So hopefully, oh, now wait a minute. I was supposed to have something like cute pop up.
Technology issues with our presentation. So this is our third version of it. So it may not have made it.
Oh, well, something cute was supposed to pop up and choose A. So hopefully you were on the right line with A, but yes, it's access to an elevator. Just again, keyword access there, just making sure Dolly can get where she needs to with her joint pain. All right.
Another truth or myth. Right now, you guys are 2 for 2. We'll count the poll into it. Second one, a medical diagnosis does not necessarily qualify a child for an IEP or a 504. Truth or myth? Oh, you guys are good. Really good. Yes, it is true. Just because a child has a medical diagnosis, it doesn't automatically qualify them. They have to we go back to that eligibility criteria. It has to impact their education of some sort. So, an individualized health plan is a little bit different. That's more of it's not as formal as an IEP or a 504, but
It's kind of just like, I have this condition, I need these things at school. Yeah. That's
Right.
the way I think. Yeah.
Yeah, so they have to meet that criteria. That's the biggest thing. We have kiddos that have ADHD, for example, and they take their medication, and some teachers have no idea that the child has ADHD because once they're on their medication in the classroom or something, they have found what works for them, and they don't need any accommodations in the classroom. So the key part is that they have to demonstrate something, some gap or some need, how it affects them adversely in the classroom in order to qualify. Nice job. And last one, and then we'll stop pestering with the participation. Truth or myth, all schools are required to provide special education services to children. Any thoughts? Did you say myth? You got it. Yes, it is a myth. And this is kind of probably the most tricky of all of our truth and myths is that all publicly funded schools require the teachers to be able to support kiddos with IEPs and 504s. The caveat there is with non-public or private schools. We have lots of schools in the area that we work with, and really we work with people all over the country too, because people come from everywhere to get services at Society Children's, which we're so lucky that we're this close. But private schools don't have to do any of this. They are, unless they have any funds from the federal or state government, they a lot of times do provide supports because it is typically a smaller school. They know the families, but they don't have to provide these supports. So I think sometimes I run into issues where the school's like, well, you know, we can't provide a homebound instructor because we just don't have the resources for it. And families get it stinks and they get bummed by it, but it's like they don't have to provide that. So that does get tricky. Especially, you know, when you're paying so much to go to private schools and things like that, but that is not something they have to provide. Here, Ryan talked about it earlier, some resources for families. This is just kind of like a chart if there are concerns that arise. We typically want to reach out to our school personnel. We like to start with teachers. You go up to school counselors, principals, somebody in the building to express your concern. If your concern is not addressed at that point, then you go up the chain. I think sometimes we jump and we go to the superintendent first of all, but we haven't gone to the principal or the teacher first. And that does strain a relationship. So I think if you kind of go one step at a time, yes, it does take longer, but you know, I think those bonds that you have created with that personnel, often they will help you get to the next step. If they can't answer it, they can't solve it, they'll help you work your way to that, hopefully that answer. So then after that, you know, IEP or special ed director, 504 coordinator. In Ohio, which as a Kentucky teacher, I would have loved to have this. They have something called parent mentors. And this is a parent of a child with a disability of some sort that works for the school district, but they help families navigate the special ed process or any type of concern, which I think that is huge. I don't have any children myself, but I think that would have been helpful as a teacher to be like, hey, I'm someone in your position that's been here before. Let's work through this together. The next step is ODE is Ohio Department of Education. So depending on wherever state you're at, everybody has an early resolution line. So we put Ohio's number here, but Kentucky has one, Indiana, all these states, they have a number to call and then you try to figure out, you tell your story, what's going on, and then they'll give you next steps from there. You can have a facilitation meeting. That's oftentimes a neutral party that comes to both with you and school to express the concern. And then it goes to filing a formal complaint and then legal aid. And something that may be just helpful to mention, if you are bringing legal aid to a school meeting, oftentimes if school isn't aware and then you bring a lawyer with you to the meeting, they may reschedule. So then that way they can have their legal aid present as well. It doesn't always happen, but sometimes I think families, they get frustrated when the meeting gets rescheduled because of bringing a lawyer because school wasn't aware and they need to cover their side of things too. So something just to consider, kind of like moving up the chain to figure out what can we solve our problems. Hopefully you never have to get past one or two because a lot of things can be handled at the school level and a lot of times schools want to handle it at that level, fix it before it gets too far and hurts that relationship between really ultimately the kiddo. Yeah, question. Mhm. Ooh, yeah. Mm-mm.
know that you're never gonna have that situation. When you think that, I felt so hard.
Right.
I tried, but not, I was that.
Right.
And no, and yes, it would be asking parents, know them, and my kids would.
Mhm. Mhm.
Right, yeah.
Yeah.
But, what do you suggest?
Yeah, well, first, I'm sorry that happened because that takes a lot to decide to be not only caregiver, but also teacher. As former teachers, it's a lot of work. So but hey, the honest efforts there. I appreciate that. I think really, unfortunately, that does happen. That there's where they just don't understand. And normally, I feel like once you get to the superintendent, they typically will take charge. I have found, especially being from Kentucky, the smaller districts just don't have the resources and they're just like really, really spread thin. And I feel like that's kind of where a lot of that comes in to where it's like, listen, we have to follow our regulations, boom, done, and it ends up to that point. But I think I would follow these tips here, and that usually once the mediator gets involved, did your child have like an IEP or a 504? Mm. And that's not what you want to hear in that case. But right, yeah, right. Hmm. I know. And I feel like as parents that of kiddos with chronic medical conditions, you guys have to jump through so many hoops. It's like there's not one process that can just be straightforward, especially how everything changes between states. They're all so different too. So like when I came to Ohio, I was like, oh, I didn't realize Ohio just has a lot more resources than Kentucky does. And there's so many more things that could be in place to help support these families that are navigating things that they've never had to navigate before. Unfortunately, I don't think I have like the right answer. I think getting the state involved is another hoop that you have to jump through. But I think oftentimes that it goes somewhere once you get in that position. Um, but homeschooling is, if that's right for your child, then that's right for your child too. Right. Hmm. Hmm.
I think at least what I would add is that typically we do, I think what Chris has said is true. That administrator seems especially difficult and not willing
Yeah.
to work with you, which is unfortunate, but sometimes we find someone else in the district that is empathetic, that will work somebody at a higher level. It doesn't sound like there was that person for you, which is also doubly unfortunate. Yeah.
Yeah. Yeah.
And I think, yeah, but I will say that at least in Ohio, I can't think of his name, but there's somebody who works for attendance specifically for the state of Ohio. And I know when we've met with him, he's very distressed to hear about these situations that happen with families. That's not the intent. That's not what they want families going through. So I think what we would recommend too is like contact the person at your state level that may be in charge of attendance. Because they may want to know that this is happening in individual districts and there may be something they can also help with. Because I know we talked about some of these cases where families are being called to truancy and he didn't like to hear that. That's not what they're out to do, especially when there's chronic. Um, certainly if you tell us, you said Kansas.
Yeah, not specific, we can call that.
Yeah.
Other, outside of.
Yeah, I mean, we'd be happy to look into it for you. I know Ohio's is just kind of on their website, like there's just this guy and he works for attendance.
I think his name's Patrick.
Patrick Hickman, yeah. So I'm curious about.
For some reason, I remember Patrick.
Yes, and we have him, yeah, we know how to contact him because we have a lot of these issues. So I'm curious if other states have somebody in a similar role, but we certainly. Right, right,
Mhm.
but.
Is this common that most children's hospitals have? Or you, Cincinnati just kind of lucky?
We're the biggest one in the nation. We went to a conference last year and we're the biggest by far and we're pretty small. There's only school liaisons there's only 11 of us. And then we have hospitals teachers and we also have psychiatry school liaisons that work in our inpatient and partial programs as well. But there's a lot of hospitals that we met that's just one person. They're also the teacher and they only work with certain populations, which the whole,
The kids that are
yeah.
hospitalized.
Yeah. For the whole hospital too. Yeah. So it's,
Cincinnati Children's was the first school liaison program to be
Mhm.
created, and it's also the largest.
Mhm.
But there are a lot of hospitals that have
Yeah.
a program of some type. It's just not as large or robust, I would say. Yeah.
yeah.
Okay, with that note, I started school afterwards, but it's like, yeah, it's your IEP, get your 504, not IEP, but 504. And the school was very willing to work with us. We didn't have that issue. It was just more like, well, we don't even know what we need,
Mhm.
you know? So.
There's a lot of different groups out there. Like I know I work with oncology, but we have like connections with the Epilepsy Alliance too. They provide education to schools and teachers because I think a lot of this, like you mentioned before too, they just don't know. And they don't know how to help. They don't, because I think a lot of times if they can't physically see it, they don't know how to help with that. And it's nothing on schools end. They just don't know any better. And they need that education, and that education sometimes just isn't there or isn't, there's not enough people to go around. Even with as big a program that we have, there's just not enough of us to go around. So yeah, there you can advocate for some more because we're always trying to advocate for more school liaisons, even in our program. Hmm. Right. Hmm. Yeah,
Yeah,
that would be super helpful.
for sure.
Is this our signal? Okay. We just have like two more slides that we'll like just quickly wrap it up. You guys have a copy of this. This is something that we just recently created that for families in other populations that may not have a school liaison of things to consider talking about with school. We know all the areas are not relevant, but like it talks about attendance, academics, social, emotional, physical, and then medical and nursing needs. So feel free to take that with you and adapt to your child's needs and then share it with school.
And then just a few other resources we have. So you may be familiar, but something we always share with families is understood.org. It's a great website for families. There's specific information about different medical and learning concerns, but also there are great templates for how to write an IEP evaluation request, 504 evaluation request, and lots of resources about just learning concerns, IEPs, questions about anything kind of under that umbrella. It's a great resource. We use it all the time. Rightslaw.com is another great resource that we also use. And this is a website that really just talks about special education and 504 law and can help you navigate if you have questions about if the school is maybe doing something you're like, is this right? Are they following the legal kind of guidelines that they should be? And has a lot of like cases that you can kind of compare to. And then again, we're sharing an Ohio resource, but every state probably should have something very similar on their education website. But this is the evaluation roadmap of what to expect when you submit a request for an evaluation for special education in the state of Ohio. It kind of has the steps as well as the associated timelines of how long to expect for each part of that process to take. And then finally, we have just each state resource here, and we certainly could share other states. These were just the ones that we listed here. But these are more if you're having further concerns where the school is not necessarily supporting and you followed some of those steps on Carissa's list. This would be if you're looking for advocacy resources, and you need that extra level of support because you've reached out to the school and they're not doing what you feel is most helpful. And each state kind of has these resources where you can reach out to. And again, I think Kansas, other states probably have something very similar, and we can certainly reach out with those.
I think the first one leads you directly to a map and then you click on your state, if I'm remembering
I
correctly.
think you're correct, yes. And then the ones below are just like the unique state websites. But yeah,
We'll provide it as well. Then I think.
yeah. We're getting the game. That's okay. Thank you so much. Yeah.
We're going to have everybody join us at this point for our last two sessions. So if you need to run to the restroom, if you want to do that very quickly right now.